The Workforce Development Programme is a 3-year programme focused on improving the clinical competence, capability and other key factors of the integrated urgent care and NHS 111 workforce. The conference today, 1st of November, is a really exciting opportunity halfway through the programme to share the products we're developing and tell our key stakeholders what's coming next and how they can be involved in the future.
My name's Alan Ryan. I'm the Interim Director for National Programmes at Health Education England. For me, the top priority is to have a workforce that feel valued and understand the importance of what they deliver to patients in the NHS. The great thing about this conference is we have a great mix of providers, commissioners and frontline staff.
Hi, I'm Anthony Keeley. I'm Head of Integration Delivery at NHS England, and as part of that I'm Joint SRO for the Integrated Urgent Care Workforce Development Programme. Well, I think we've got such an opportunity with the work that's going on to develop a new, more robust clinical advice service for integrated urgent care. A real opportunity to transform the workforce and to transform the role of 111 out-of-hours services and all of the clinical services that support them, to transform those services in a way which really helps take the pressure off the acute system and gives patients a better experience of the whole of the urgent care services in the NHS. So I think the real priority for the workforce is to make sure we're developing the right skills, the right competencies, and obviously having the right numbers of professionals supporting all of the rest of the workforce in this service.
I'm Matthew Swindles, and I have the privilege of being the National Director for Operations and Information, which I've been doing for about the last 5 months now. It's a new role which brings together the commissioning function of NHS England, the regions, information and IT. Integrated urgent care is a classic example of that systems thinking, that when we run services for patients that are in silos, we get duplication, we get failure at handoffs, and we get a poor service. And a core element of that service, of that integrated urgent care, is the role of 111. How do we create a shift, what you might call a channel shift, of people to get their care in the right place at the right time in a way that is more appropriate to the needs of the individual? So the service offered by 111 is an absolutely crucial part of that channel shift. How do we create the space for GPs to see the people that they should see? How do we create the space for A&E to manage the people that they should see, so that we offer a better quality of service for everybody? And how do we get it so that people who just need advice can just get advice, rather than having to give up a morning while they wait for while they wait for a GP appointment? When you think about your workforce, the question isn't really about bums in seats and vacancies. It's about the critical contribution that that workforce makes to this shift, without which we can't make the NHS work. Is our staff morale, is the support, is the level of training, is the skill set that we're getting the right ones we need? We're taking something like 14 million calls a year now through 111. But of the people who call 111 are told to go and see a GP, half of them still go to A&E. So we're not getting traction in the advice we give. So we need to create an existence for the 111 service that sees itself as part of a fundamental transformation in the NHS, not as an add-on. And we need to have our staff, our workforce, understanding and believing that they are actually part of a campaign to make the health of people better, and not just turning up for work.
Dr. Helen Thomas. I'm the National Medical Advisor for Integrated Urgent Care. I work for NHS England in London. I think improving the quality of life and the retention of the health advisors, as they are the key people to the whole of the Integrated Urgent Care Clinical Assessment Service. So they're the first moment of contact for the patients.
From April 2017, there'll be 60 whole-time equivalent pharmacists funded to go into clinical assessment services as part of a 111 service, and 120 training places on a new programme to create independent prescribers. So part of shifting the workforce to be suitable for the new ways of working rather than for the old ways of working. So maybe I'll close by quoting folk singer Grace Petrie, who says, be strong, be resilient, be brilliant. So thank you very much.
My name's Michaela Littlewood. I'm Head of Nursing and Quality Assurance, and I work for NHS 111 in Yorkshire Ambulance Service. I think the top priority for me is going to be recruiting the right staff, particularly clinicians who've got the right skills, who are enthusiastic about working in a new and different creative environment.
It's a joint partnership arrangement between NHS England and Health Education England, and the purpose back at the beginning was for us to address issues around workforce attrition, trying to increase hear and treat, reduce the number of 999 and emergency department dispositions, but above all, invest in what we felt was one of the most important workforce areas within NHS, handling the front door of out of hours and urgent care. We're trying to develop the workforce, the really important workforce of health advisors, clinicians, and more widely to be able to support patients to best we can whilst delivering care.
My name's Sharon Harrison. I'm a National Programmes Manager. I work for Health Education England, and this programme is very much a joint programme with NHS England to develop the programme in terms of looking at what our overarching aim is to support the development, and you'll hear it quite a lot, of an optimal integrated urgent care workforce for the future. And our job is really to look at developing a blueprint which will include a career structure with skills, levels and competencies. And the aim is really ultimately to improve the service that patients are getting, making sure that we can assure the quality and improve recruitment and retention of your staff. So all really important things. One of the elements that we're looking at is apprenticeships. So that will go across the whole of the career trajectory. I mean, the potential is that could go up to master's level.
The next part that we're working on right now is the Integrated Urgent Care Clinical Assessment Service, C brackets Clinical Hub. So we're looking at the core competencies and those components that allow people to practice effectively within that environment.
My name is Ian Upton. I offer a patient perspective with my unique patient voice. I've had throat cancer, I'm nearly blind, I sound about this, and I haven't eaten a meal in 4 years. Right. This patient voice is so important, and apparently it is. You can read any NHS strategic paper, and it goes on about patient engagement, involvement, the voice. But mine, your routine, your everyday practice, it's not my routine. You do it every day. I hope to do it once in a lifetime. I might even help you recognise good and bad practice. I've seen plenty of both. What you think might be good and effective, I might think is frightening and hopeless. Ask me. I can tell you. But compassion impacted me many times. It opened my attitude. It made me feel better. You show me compassion, and you make a difference. I will remember.
So we're working to provide accreditation to the courses and training that staff undertake, which together will deliver a career framework
My name is Rachel Smith. I am co-developer of the Calderdale Framework and a Director of Effective Workforce Solutions Limited.
Hi, I'm Jane Duffy and I'm the other co-developer of the Calderdale Framework and also a Director of Effective Workforce Solutions Limited.
Okay, so we were commissioned by NHS England and Health Education England to work with 2 reference sites, and that was to use the Calderdale Framework to start to tease out what the optimal workforce would look like in NHS 111, and out of that has come job descriptions, competency sets and a career framework. I think the future is potentially very exciting for the future 111 integrated care workforce, mainly because it's the potential to be in a larger integrated hub, which will give potentially a much better service for patients and potentially a better career pathway for staff in those services.